a 35-year-old patient that came into me, and this is going to illustrate, you guys have all these elaborate, complicated ways that you're treating these things. I didn't do an awful lot to her, but I do think it created a nice rejuvenated appearance. So I guess kind of starting from the end, talk about what you would do, thoughts on the results. I mean, what would you do?
Well, from what I see here on this patient here, she has some sun damage, photo damage, looks like a little bit of melasma on the side of her cheek there. That's something I would address first and foremost as far as the quality and texture of her skin. Once again, I would approach that with different light-based energies. If somebody has melasma, I would not go to BBL, broadband light, or IPL, because that tends to make melasma worse, actually. I would do different combination light therapy. It looks like there was submental fat loss there, so Kybella or PCDC for contouring. Her jawline is definitely much more enhanced and defined. That, to me, when I tend to do that, I will go ahead and do either Bellafill or Radius along the jawline. Now, some people will also use Sculptra, which is equally as good. I also see that you gave her definition and contour in the cheekbones and in the aperture as far as the apex. Her nose tip looks more lifted, if you take a look at it, as well as the distance between the top of the lip and the tip of the nose, and her philtrum looks much more defined.
Top down, I agree. The nose looks lifted. I think her whole profile is just dramatically improved. Her lip, if you look at the true vertical line, everything aligns. Her chin aligns with the lip and her nose, and it's just perfect. I think in terms of volume enhancement, there's probably very little that was done. Minuscule amounts, but there's probably some volume enhancement because her tear trough is alleviated. The jawline looks amazing. I think a couple of ways you can achieve that with this case is either threads, barbed threads, or even like a HIFU or like a Ulthera type lifting energy-based device, and or possibly adding the fillers to the jawline. But I think it can be achieved with mesotherapy, Kybella, and an energy-based device, and of course some skin improvement in terms of any laser therapy.
Beautiful.
Alan?
Beautiful hair, eyebrows, and eyelashes. So you can choose whether you'd want to enhance or just protect those areas with non-invasive therapies.
I think you did an amazing job. She looks like 10 years younger to me. How old is she?
35.
Like 30. So I was going to say, somebody like her, like I saw her, like she actually will respond to everything that you had said. Me being the Sculptra guy, I will do Sculptra, and I think I'll be able to get similar results. Not as sharp, probably, of the jawbone and the chin. Probably after I do a round Sculptra, I may switch to Radius or a Hydro G Prime product to get that beautiful contour that you achieved on the jawline and the chin. I love what you did with the brow. I don't know if that was done with neurotoxin, but overall, she looks like a younger version of herself, even though she is actually young, right? So this is more like an enhancement prevention type of result.
So I agree, amazing result. I think in the left side and the before picture, even though she's young, I think she looks a little frumpy. I think what you've done is kind of align everything. If you look at the before, there looks like there's a piece missing from the front of her chin, a piece missing in the pre-jowl sulcus, and a piece missing at the angle of the mandible. So you've kind of added to that, and now the eye catches that straight line, and the face looks less round and heavy. I think you've done something with neuromodulators to kind of reposition the brows. The skin looks better. I'm still trying to figure out if you really did anything to the neck, or that's just a result of doing the jawline.
So what we did, we basically started with the fabric. Okay, put her on a medical skincare regimen, a series of chemical peels. We use a lot of microneedling, PRP in our practice as well too, a lot of biologics. That's why you're seeing the improvement in the skin. For the upper third, what you're seeing is the effects of the neuromodulator, as you pointed out with the brow. Try to shape that. Mid face. I try to recreate a V-shaped look, and so I use a lot of fillers for the chin point, lips, also cheeks, so you can create that V up on a woman. I think it's beautiful. So what I did is voluma in the cheeks, Volbella in the lips, and I actually didn't do anything in the chin here. For the neck and jawline, I use the effects of Kybella, which Kybella not only dissolves fat, but it also creates inflammation. You know, and so as we know from inflammation, what happens with that, we get skin tightening. So, you know, what I was trying to do essentially is not only get rid of a little bit of fat, so fat dissolution, but also too, I come up along the jawline, I inject the jowls, and I try to create basically a little bit of a lip. So that's what I did for her. Very happy patient, and again, I think, you know, I think it really kind of illustrates how you don't have to get very complicated, and you certainly don't have to, you know, as you know, you've got surgeons sitting down here, you don't always have to go the surgical route, and you get a result for a patient that they're very pleased with, and that's durable as well.
How many sessions of Kybella did you do to get this result?
I did two vials apiece.
Okay.
And when you do the Kybella, are you using it as a mesotherapy technique into the face as far as for skin tightening? You're diluting it down or using it full concentration?
No, I'm just using it
full concentration, but just lower dosing as far as the injection sites?
Right. Yeah. Usually I'm using about a 0.1. I mean, a lot of times if you're using it for fat dissolution, you're using about a 0.2. So I go a little bit less, and I really spread it diffusely, so I'm creating more of I'm kind of really shrink wrapping everything. So I'm trying to address the submental fat, but also trying to address the skin laxity around that and create a more sculpted jawline.
And would you continue to do that as a meso technique for maintenance, or would you at that point interject microtoxin for the face and the
A
little bit of both?
The nice thing about combination therapies is there's so many ways to get from point A to point B. Right. I mean, you know, anybody that gets up and says there's only one way to get there, they're very myopic, okay? Because nowadays you can use, you know, energy-based devices, biostimulators, fillers, neuromodulators, skincare, what have you, you know, and create, I mean, you know, you're hearing from the panel here that there's a lot of different variety of ways of doing it. So, you know, first key thing is understand what's in your toolbox, what works best in your hands, and then you can create these, you know, these great results that are obviously all these results are non-surgical.
And that's something that I actually want to emphasize that Dr. Buford just brought up, is that you have to see what's in your toolbox. Everybody has different clinical expertise and skills, and this is the reason too, through Empire Medical Training, when people come and take these training courses and programs, people get the wisdom, the pearls, the different experience from every single instructor who has different experience and expertise. And I think that's something that we all learn from each other. That's the reason we go to conferences, go to CMEs, we all have these panel discussions, we all compare notes with each other because we can all learn from each other. And I think that's something that is very valuable for any practitioner, especially in the world of aesthetics, from a safety standpoint, from a cosmetic end result standpoint, as well as just for people to be able to enhance and give natural results, as opposed to just doing things because not one size fits all, as we know in the world of aesthetics.
Yeah, I mean, I would add to that you know, learning from your peers is invaluable. You know, and if you think you're so talented, you don't have to learn anything anymore. It's about that time to hang up the shingle.
Absolutely,
really
absolutely. That's so true.
Okay, so similar thing. Actually, the after, they misplaced it. After's on the left. Before is on the right side.
Okay.
So what would you guys? I'll start with Ramtin. What would you?
So yeah, from the redness on the after, I would say she definitely got some sort of laser surfacing or some sort of tightening device to her face and neck. Lips look enhanced. The distance from the nose to the upper lip looks shorter, so that looks more youthful and aesthetic. Upper third of the face has been lifted, I would guess neuromodulators, and maybe even some along the jawline. Nice job.
Sheena?
Yeah, I think the skin quality looks amazing, so kudos for doing that for her. Again, she looks relatively young, but start looking a little bit tired, a little frumpy. But I can see, again, you do a great job in giving that really beautiful triangle of U shape. The jawline, I love the way you always do jawlines, and the chin, so she looks so much refreshed. Definitely a few years younger, even though she's young, but definitely looks like a younger version of herself.
I'm sure you're recommending a non-invasive regimen to her for her hair because it looks beautiful. It's gorgeous and shiny and full and thick. So maybe she's using low-level laser therapy or.
We actually use Nutrafol for most of our
I was going to
patients,
say
so-
nutraceuticals. So Nutrafol.
Which I'm
women's-
on as well too. I mean, no plug for it, but it's, you know, it does work. You know. I mean,
Me
great
too. I
practice.
take it just for prevention. You never know.
And I
Oh, it
take
totally
it.
does.
I take the Nutrafol for women. I think we all
It's
do
great.
too.
I mean,
It works
you know,
great for everyone.
I mean,
Yes.
why wait until your hair is not good quality? I mean, I think
No, you have to be proactive, and so that's super smart. And Such great nutraceuticals. Nutrafol is definitely an excellent choice. Excellent choice. Low-level laser therapy, something she could do at home, in the comfort of her own home, to really stimulate good functioning from the follicles. And if she did need PRP, that's something that we would do once a year in the office.
Yeah, I think very minimalistic approach to this one, just to get her to the after. You know, skincare regimen, maybe some microneedling with some PRP, some periocular, the rhytids there. The lip definitely looks enhanced, which helps her profile. Again, looking at the true vertical line and the profile enhancement, and some chemical peels possibly. But I think very little, if any, or maybe not even any filler was used in this case.
right.
Except for the lips.
From looking at this, what I see, what catches my eye is the way that you actually have contoured the nose, and she has much more definition on the nasal bridge. And if that's the result from the skin tightening or the result of enhancement with the fillers, I think that's actually a very good result. She definitely looks much more angled, contoured, and she has definition in her face, which she didn't have before. So that approach to me would be a combination of chemical peels, laser light therapies, as well as radiofrequency microneedling, because I think that's a great energy for tightening. And then the filler, for me, I tend to do a combination of fillers. I actually layer my fillers depending on if I'm trying to go ahead and do the contouring for the jaw and the cheekbone. I will go ahead and layer the radius and then Voluma on top of it, or combine with sculpture throughout, because the sculpture also, what's nice about it is also enhances the quality of the skin that I've seen.
You know, you're talking about biostimulators. A lot of times, what we'll do, you know, depending upon our patient's age and so forth, and what they want to accomplish, it's very, very common for us to actually combine things like PRP actually with her fillers. So here, the redness. Unfortunately, she actually didn't get a chemical, or she didn't get a laser. She got chemical peels. She went out and sunburned, unfortunately. So sorry, guys, this is not from any of that stuff. I actually did nothing to the nasal bridge. Improvement in skin quality was a series of basically a good skincare regimen, chemical peels, as well as microneedling with PRP. And also, too, I'm a big fan of restoring volume to the mid-face, and then going back down. TJ, I think you pointed this out exactly. You know, her lips obviously have been restored. Trying to create that V-shaped look. And again, I look at it starting at the chin point. I look at the width of the jawline as well too. You're seeing an oblique view, so you can't tell. You know, but she did not need any narrowing. If I do, and this is very, very common, I'll use a neuromodulator to actually try to kind of narrow that jawline in and really restore that heart shape or V shape look. So that's what we did here. So I mean, pretty straightforward, pretty simple combination approach.
How many syringes of filler do you use to restore the mid face at the chin? If you
You know, someone this age, usually about 2 or 3.
2 or 3, beautiful.